Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone, here we have a patient in the ICU. You scanned, patient is unstable. You scan and you get this view. First of all, what is the most important abnormal finding on this case? Third, patient has what type of the device and why it has been used based on this. And you are going to get it PSAX for the mitral valve level and papillary muscle level. What maneuver you should do before twisting or after twisting for PSAX? Only one maneuver. What maneuver you should do to get correct PSAX at the mitral valve level and the papillary muscle level? You are scanning a patient and you get it a PSAX almost between mitral valve and tip of the papillary muscle, as you can see PSAX. Is that correct PSAX at that level or not? And if it's not, what maneuver you have to do to fix it? And you know a correct PSAX should be what parameter and criteria has it. Here we have two cases of PSAX. Both of them are abnormal. It means not abnormal. Both of them are not correct PSAX. This is at the mitral valve level. This is after mitral valve, between tip of the mitral valve and papillary muscle. So what should you do? What maneuver you have to do to fix the image? Because it's not correct. Both of them are not correct. You are scanning a patient in ICU and you get it this view on the PSAX. What level is this? First, second, what problem patient has, and another. With this finding that you can see which area you have to looking for in the apical window. Here is another patient. You are doing PSAX. You see this one. Is that correct PSAX or not? If is yes, what abnormal finding you can see and patient what the patient has. If it's not correct, why and how you fix it. Here you get it a PSAX at the base of the heart at the valve level. You have aorta very clear, nice, but you don't see all the tricuspid. What maneuver you should do? Just one maneuver. You should do and clear, make it all area and this area of the right atrium and tricuspid valve. Second, after you finishing that one, what maneuver you have to do? Open up to the pulmonary artery and show the bifurcation or saddle of the pulmonary artery. It can be one or two maneuver. It's up to you. Just see how you can find the answer. Here we have another. You are getting at the PSAX at the aortic valve. Now you want to see the pulmonary and bifurcation. What maneuver Tech has done to get this view? Just one maneuver or two maneuver, dependent. Many parameter and landmarks. Okay, the last one. What windows and what view is this one? And what patient has and what maneuver should be done to get PSAX at the level of the papillary muscle. Now let's see how we fix those.